Hello, dear friends. This is Sofya Dorinskaya, President of the International Bureau for Human Rights in Mental Health and head of the Sofya Dorinskaya Center for Medical Information. Today I would like to answer a question or questions that you have asked me. Sofya, I don't understand how your test works. Aren't we supposed to have blood tests to find out which vitamins and minerals we're lacking? So how can you determine that with a test? Well, that's just how smart we are. I'll tell you right away, because we are very proud of our test. And it's true that we've made a real breakthrough in discovery, specifically in the area of addressing people's deficiencies. And I share it with you, sell it to you, and talk about it with a clear conscience. And I really enjoy reading about how our clients feel better and better every day, literally from the very first time. It's very interesting here with us. There was one client, he's a subscriber to our channel, and he kept writing to me over and over. I told him, well, take the test, just take the test. And he said, well, here it is. And sometime at the end of the year, he said, all right, send me your test. I sent him the test, and he sent it back to me, filled out. I said, well, now you need to pay. He said, Sofya, do I have to? So I wrote to him, well, did you fill it out just to make me happy, to make me feel good? That's it. And this person thought and thought and thought and then paid for the test. So we made the recommendations and gave them to him. I said, all right, are you going to buy the vitamins? So he went to the store, to the pharmacy, and bought something. I asked, so what did you buy? He said, well, I'm drinking something. I said, all right, and how do you feel? He replied, I don't feel anything. I said, well, send me what you're actually taking. So he sent me what he was drinking. I said, no. So and that's how we communicated with each other, I'll tell you, from January for about a month and a half. So I said, well, that's not it. Look, we said this, but you did something else. And that's how we kept chatting until about mid-February. And I told him, listen, let's just forget everything. And here's my recommendation. Please go to the pharmacy. You need everything. Just go and buy it already, please. And I'm happy to tell you that today is this person's first day under my supervision. Naturally, knowing that this is the kind of person who needs so long to pull himself together. Today yesterday was his first day under my supervision, and I have everything noted. I write to him, so, how are you doing? And before, he would always write back, nothing will help me. I mean, here I am, this and that, I told you, this, that, and the other. But today he writes to me, you know, today I have so much energy. The weakness in my legs is gone. It's the first day the person follows the recommendations. The weakness in my legs is gone. Today I feel so energetic. I'm in such a good mood. And you know, it feels like he asks me, so what should I do next? Well, just keep going, really. You're doing great. That's it. And I am very pleased to answer your question today about how it happened that Sofya Dorinskaya and her colleagues made such a major breakthrough. There is a scientific method. It's called screening. Screening is essentially a form of testing. It represents a type of research that is systematically conducted through various tests. And the greater the overall quality and precision of these tests, and the more profound the underlying scientific foundation on which these screenings are based, the more effective and accurate they will ultimately be. So, what exactly is our screening test based on? It is based first and foremost on propedeutics. Propedeutics is an essential and foundational scientific medical discipline on which the entire field of medicine is actually based. I can tell you a little secret. Absolutely all of the modern instrumental diagnostic methods used today are merely auxiliary tools. Believe it or not, they simply cannot replace the core principles of clinical study. And all of medical practice proves this at every turn. A recent example, the website Doctor at Work. A patient died, a young patient, from pneumonia. They started IV therapy. The X-ray showed clear lungs. Believe it or not, the X-ray shows clear lungs. Things like this happen very often, for example, with psychiatric patients. The X-ray shows clear lungs, Psychiatric substances distort the clinical course of diseases. And for example, an inflammatory disease like pneumonia, which should cause a fever of nearly 40 degrees. But since the person is on psychotropic drugs, their temperature is 37.9, 38.2. So they prescribe some antibiotics, right? At autopsy, there are 2 liters of pus in the lungs. I'm telling you a real example from the psychiatric hospital where I worked. This happened before my time. But the doctor who missed it told me about it herself. It was her patient's death. So even though all the clinical signs, specifically the propedeutic ones, what we observe in the patient, were right there on the surface: pulmonary weakness, sweating, and so on and so on. And if you look at a person carefully, then pulmonary pathology, if you know how it manifests in a person, honestly, it's hard to miss, because pulmonary weakness is very distinctive. The person can't even lift their eyelids. They're so weak, this is pulmonary weakness, that it's even hard for them to lift their eyelids, right? And yet additional diagnostic methods show that everything is fine and there's nothing to worry about. So our screening test is truly based on knowledge of propedeutics. It's based on knowledge of biochemistry. That is, my colleagues and I spent a very long time working with biochemistry, delving into the intricate interactions of minerals, trace elements, and vitamins. Because I can tell you, this is the most complicated area in the entire human body. In general, pathogenesis, the pathological cycle of diseases, is more or less understood for everyone, and one way or another has been uncovered, unless we're talking about mysterious illnesses like mental disorders. If we're talking about real diseases, then in principle, etiology and pathogenesis, etiology being the cause of occurrence, these things can basically be revealed, understood, and so on. But you understand that vitamins, minerals, and trace elements are the foundation of interaction. They are the basis of the organism's life. And for example, I can tell you that sodium and potassium are 2 antagonists. There is always something lacking in the body, either sodium or potassium. And this can vary throughout the day. And you need to know how this whole machine, how it all works in life in order to understand which combinations, which antagonists different substances are. That's why our screening test is truly based on the mathematical calculation of the interactions of these substances, because not only biochemistry but also mathematics is the foundation of our screening. And the next greatest discovery, which has never been applied to medicine before, and why our test is truly effective, is that it occurred to us to apply one of the branches of a science like statistics. Whether you choose to believe it or not, absolutely no one has ever actually thought to apply the complex field of statistics to a single specific individual person. But it suddenly occurred to our team to do exactly that. And as a direct result of this extensive research, we have successfully engineered and developed a truly highly sophisticated and remarkably effective test that is specifically designed to help identify and analyze deficiencies in various essential nutrients and provides the most precise, pinpoint recommendations for every single unique individual. Now, what is the other major problem we need to address? Well, all right. If, with some effort and surrounded by textbooks, you can more or less understand all of this, the complex interactions between vitamins, minerals, trace elements, who acts as an antagonist to whom, who interacts with what, and so on, then when we start talking about deficiencies, things get even worse here. I'll be honest with you, because first and foremost, deficiencies, you might say, well, all right, we already have some balanced vitamins at the pharmacy. You take them and everything's fine. Everything is great. On one condition, if you don't have any deficiencies. But if you do have deficiencies, they don't just get restored in the body that easily for one simple reason. There are so-called primary deficiencies and there are so-called secondary deficiencies. And on the surface, even if you go to the doctor, even if you're lucky enough that your doctor knows how deficiencies of certain vitamins, minerals, and micronutrients manifest, the symptoms and complaints you have may indicate a deficiency but a secondary one. For example, calcium. Everyone knows you need to take calcium. Everyone knows you need to take calcium. But if you don't know that calcium deficiency is a secondary deficiency, and if you don't know how to address the primary deficiency, and if you don't know how calcium interacts with other substances, and if, you just start eating calcium by the spoonful, first, it won't be absorbed, and second, you'll only make things worse for yourself. Well, you won't die, of course. But then you'll come and say, nonsense, I eat this calcium. How do people come to us? We say, you have a calcium deficiency. They write us these long messages. I eat this calcium. I live in a room made of calcium. All my dishes are made of calcium. My spoons are made of calcium. I gorge myself on this calcium, but the calcium still isn't being absorbed. And it doesn't get absorbed, and it never will, because you need to know how to make calcium get absorbed in the body. That's it. Next. And this is exactly what makes our test incredibly effective. And that's precisely why our clients who follow our recommendations to the letter, almost ridiculously so, just like I told you with one of our clients whom I've been in touch with since January, right? That's it. Here's the first day when the person started following the instructions properly. Here you go, the first day and the first review. And we have plenty of such reviews. Next, people ask me, what if my deficiencies and my condition are actually symptoms of some disease that I don't have? Well, look, my friends, here's the thing. The truth is that vitamins, minerals, and trace elements are, to be honest, exactly what our bodies are made of. If we take Karl Marx, life is, how did he put it, the existence of protein bodies, right? So, the truth is that amino acids which make up proteins are not absorbed if you have a deficiency of minerals, vitamins, and trace elements. This is something you need to know. Therefore, if you already have a pathology, there is the so-called preclinical stage. And then the clinical stage, at that point, you are already getting sick. That's the blue area. The preclinical stage is the transparent area. It's the transition of the body's state from health to illness. So the preclinical stage is always an imbalance of vitamins, minerals, and trace elements, which then develops into a pathology, some kind of crisis, a critical situation, and so on. So, if you have some kind of condition, meaning you feel that something is wrong, but you go for checkups and they can't find anything, then it can be assumed that you are in the preclinical stage, even though you already feel unwell. Therefore, if we catch the situation at the preclinical stage, the disease might not develop at all later on. By observing how a person's deficiencies are resolved, we can determine whether there is some factor in the body that prevents these deficiencies from being replenished. I can tell you that there are some people who have already started their programs, and we notice that something is off. We start digging deeper and say, and we suspect that something might be going on. It could really be parasites. For several people, we pointed out a predisposition to diabetes and sent them to an endocrinologist and told them, so our people went and they were told, your blood sugar is normal. And they were told that they just need to see an endocrinologist regularly because, well, it was pointed out to them. In one case, a woman was indeed found to have giardia. In another case, they said no, there was no giardia. But it turned out that she had been taking some substances that she hadn't told us about. So these were pills, right? And can we say whether the person has told us everything they are taking? Because I'll let you in on a secret. The side effects of almost all medications, regardless of which field of medicine they belong to, are actually manifestations of deficiencies in vitamins, minerals, and trace elements. And if, for example, you come to us for information about certain pills, well, we specialize, of course, specifically in psychiatric substances, then we can tell you that sometimes we inform you about which deficiencies in particular substances these medications can cause. Or there was some more here, right? So there was some substance that was more or less okay. To be honest, I don't really remember anymore. There are a lot of requests coming in. But we pointed out that if you take this particular pill along with these 2 vitamins, nothing will happen to you, right? So whenever we can inform you about something like this, we always do, without exception. This is yet another reason why deficiencies may not go away so quickly. It's another reason for suffering. You take some substance, some pill that was actually prescribed to you, and the side effect is a deficiency of certain nutrients. And next, since we do not cooperate with any pharmaceutical company, we can, well, already figure out which companies say one thing and produce something else, to put it bluntly. Of course, I will never tell anyone because, well, I don't want any problems of various kinds. But when we give recommendations to our clients, we immediately tell them, buy this, don't buy that, this one hasn't proven itself. There are some supplements. Just today, for example, there was a client. I started feeling unwell. We look and it turns out there's garlic in the ingredients. All right? So he needs to buy a different product that doesn't contain garlic. Garlic isn't bad, but for this particular person it just doesn't suit him. So for example, we now know exactly which pharmaceutical medications that are priced at significantly higher rates than our own test are nothing more than inactive placebos because they are completely ineffective. Because we have quite wealthy people coming to us, and when we tell them that they have such serious deficiencies, they send us their bottles, so to speak. Well, descriptions, yes, of the bottles they buy somewhere in America or elsewhere, paying huge amounts of money for them. And you see these kinds of lists like 200% of the daily value in a single tablet. And it turns out that all of this is just hype. None of it is actually needed. And meanwhile, the person is left with severe deficiencies and has no idea what's going on. That's why when you approach the issue wanting to solve a particular problem, you can always solve it. There is always a reasonable solution to your problems. And for example, psychiatrists before the era of neuroleptics, especially Russian psychiatrists such as Maya Sischev Vladimir Nikolaevich, clearly pointed out that a person can develop a predisposition to mental illnesses. And he named 3 things: hunger, vitamin deficiencies, and head injuries. Hunger, if we apply this to the present day, means all these diets like let's lose weight until we're skin and bones, it's forced hunger, it's poverty, and videos about what our current minimum food basket is like. This can no longer withstand any criticism at all. So it's hunger, and it's a predisposition to mental illnesses. Vitamin deficiencies. If you don't eat properly, if your children don't eat properly, that's a predisposition to mental illnesses, as well as head injuries. And so, to repeat, we had several people come to us, 2 people who had undergone electroshock therapy. Well, that's a legal procedure, right? So, electroshock therapy, according to Maya Sischev, is an intervention. It's a trauma, it's a head injury, and it predisposes a person to the development of mental illnesses. How does this manifest? If a person who has not experienced all these things, hunger, vitamin deficiency, and head trauma, shows signs of mental disorder when their blood glucose drops by 50%, then people who have experienced or are experiencing or have hunger, vitamin deficiency, or head trauma, to put it bluntly, go insane when their blood glucose drops by just 10%. That is precisely why we are so incredibly joyful, and believe it or not, I am truly deeply happy that we can actually state, based on the groundbreaking scientific work and revolutionary discoveries of Maya Sischev, that we are engaged not only in the vital prevention of psychosis and neuroses, but also in actively working toward completely eliminating already formed predispositions, those deep-seated predispositions to various types of complex mental illnesses and disorders. That is exactly why, by coming to us and taking our comprehensive test, you are not only able to fully restore your physical health and vitality, but you can also make your inner balance and mental health completely stable and truly unshakable. This was Sofya Dorinskaya with you. All the best. Goodbye.